Dr. Jagruti Shah, preventive diabetologist from Bombay. You are watching me on a sifi.com.
Kindly update us on the methods used today to control blood sugar levels to cut down on the complications.
See, the methods of diagnosis of blood sugar, that means whether it's a type 1 diabetes or type 2 diabetes, we need a proper blood sugar fasting. Fasting means 8 hours fasting minimum, and postprandial, that is 2 hours after the meal, that is lunch, that is 2 hours after beginning of lunch. These are the two basic tests which we recommend in all diabetic population for diagnosis as well as for the treatment. Nowadays another method has been highly popular and been accepted by various diabetic associations all over the world, including WHO and American Diabetic Association, that you should do glycosylated hemoglobin also as a diagnostic tool and a tool to be used to prevent complications of diabetes. When we say glycosylated hemoglobin is a HbA1c, and that should be normally between 5.7 to 6.4. Anytime values above 6.4, that is, we confirm you to be a diabetic. When you maintain your glycosylated hemoglobin below 7, your chances of having a good quality of life with diabetes are very high. But when you maintain your glycosylated hemoglobin above 8, then possibilities are there that your quality of life will get compromised. Not only that, you are likely to suffer from various micro and macrovascular complications of diabetes involving eyes, heart, kidney, brain and other part of the body. That's why this test becomes very important diagnostic as well as prognostic tool. That indirectly gives us the information not only of the blood sugars on the day of testing, but what the patients have been doing at home and when they report to the doctor. So we indirectly guide them correctly. Other parameters or diagnostic technologies we use for monitoring the patients are lipid profile, kidney function test like BUN, serum creatinine, urinary 24 hours microalbumin or urinary microalbumin by urinary creatinine ratio, GFR, and uric acid and serum electrolytes. These are the parameters we try to check periodically, maybe in some group of patients at least once in a year, to find out whether there is any kidney involvement in diabetes or not. Liver function tests, especially like alkaline phosphatase, SGOT, SGPT, and parameters like which we try to judge whether there is any associated fatty infiltration in liver or not. Maybe periodically we do a sonography of the abdomen to judge the kidney functions, to judge the liver functions, and sometimes to see whether associated complications are there or not, like gallstones or not in patients who are obese or not, or some other associated factors that which might be contributing to the ongoing damage. Parameters like electrocardiogram, that is ECG, or 2D echocardiography of the heart are the routine tests which we try to do the judge the functions of the heart. Atherosclerosis scanning, that is what we do very routinely in our clinic. It is a colon vascular profiler that not only judges the arterial stiffness and predicts the early heart involvement or early macrovascular involvement, and if we are able to judge that early, the possibility is that the reversibility we can start achieving it early stage. So instead of allowing the blockages to progress from 30 to 40% to 90%, we can regress from 90 to 70 or 50%. So sometimes this type of test modalities becomes very useful. To assess the nerve functions, sometimes we use the specialized test like clinical examination with monofilament or tuning fork, or we try to use investigations like foot analysis, and we check the various sensations of the nerves of lower extremity and upper extremity and try to judge whether patients are likely to suffer from any nerve related complications of diabetes. See, it's like this. There are some tests we have to do routinely, like blood sugar fasting in PP. We recommend that at least monthly patients have to do. Some of the tests we recommend at least once in a year. some tests sometimes we recommend even once in a 3 years are sufficient. Like say for example, if we suspect some patients to have some problem, then we do a stress testing, and in some group of patients we do a carotid Doppler or other parameters we use to find out whether any vascular involvement of the brain is there or not. Last but not least, the most important being the eye. Regular eye checkup once in a year is recommended in all diabetic patients to find out complications of the eye, and that is premature cataract development to frequent changes in spectacle numbers, increase in the pressure in the eyes, or the retinal damage because of microvascular damage in the eyes leading to different types of retinopathy. To evaluate that, patient needs to go to the expert and never wait for vision to get compromised, because many times when vision gets compromised, it is too late. I mean, sometimes even if you try treatment, sometimes the results are not reversible.